Hello, my name is Elena. I'm going to be your nursing student for today. I'm going to go ahead and wash my hands, and I'm going to pull the curtain for privacy, and I'm just going to check and make sure I have the right patient. So can I check our identification tag?
Stephanie, 11/21/82.
Okay, perfect. We're just going to do the head-to-toe assessment just to get a general information on what's going on today, okay? Okay, first I'm going to palpate your scalp and check for any depressions, lesions, or anything abnormal. This time we check your hair too. And now I'm going to go ahead and check just your overall face. Your eyebrows look symmetric, no eyelid drooping, and your eyelashes look healthy. I'm going to check your maxillary sinuses, pain or pressure, frontal sinuses, pain or pressure. Okay, your nose looks symmetric, no lesions, so we're going to check for patency. Sniff. Okay, sniff. Can you flare your nostrils for me? Okay, now I'm going to check your lips, and they look moist and pink. We're going to check your cranial nerve 7, which is your facial nerve. Can you smile for me and puff out your cheeks? Now we're going to check your spinal or cranial nerve 5. Can you close your eyes for me and let me know when you feel this? This is your trigeminal nerve. Okay. And now I'm going to go through and just shine the light in your eyes, nose, and mouth. Okay. This is going to check to see if your pupils react equally to light. They both react equally to light and they're round. So now I'm going to check in your nose for deviated septum, anything abnormal, any polyps, okay? Okay, nose looks free and clear. Now I'm going to check your mouth. Check your mucosal membrane, and then your tongue looks pink and moist, and your teeth are white. And then we will check, can you stick your tongue out for me? Your uvula, there's no deviation, and then the floor of your mouth, please. Okay, pink and moist, free of lesions. Okay, now I'm going to move on to your ears. Check your auricles. Any tenderness? Okay, and your tragus, any tenderness? Yeah. Okay, well, now we're going to do your speaking test. If you'll cover one ear, and then repeat after me.
5, 6, 7.
Okay, perfect. Now we're just going to do a visual of your trachea. It looks to be midline, and we don't see any bulging thyroid, so that's good. I'm going to test your cranial nerve 11, which is your spinal accessory. Can you show your shoulders, please? Okay. At this time, I'm going to feel for your carotid pulse, one at a time. Okay. Now I'm going to auscultate for a carotid bruit. What we hear is swishing, and that would be from hardening or narrowing of the veins, okay? Next, we're going to go to the anterior thorax. We're going to do respiratory. I'm going to feel for any temperature and make sure the skin is the same color as the rest of the body. And this time we're going to test for respiratory excursion, so I'm going to take a deep breath. Okay. Respiratory excursion is symmetric. So now I'm going to osculate breath sounds, okay? Sounds pretty clear for your wheezing and bronchi. Next, I'm going to go to your anterior thorax cardiac. I'm going to check for any visible pulsations. And then your heart is located between the 2nd and 5th intercostal space on the left side of the sternum. Now I'm going to osculate for your valve sounds. On the right side of your sternum, you have the aortic at the 2nd intercostal space. On the left side of the sternum at the 2nd intercostal space is the pulmonary. The 3rd intercostal space is Erb's point. 4th intercostal space is the tricuspid, and 5th intercostal space is the mitral. And then your apical pulse is going to be at the left midclavicular line at the 5th intercostal space. Okay, now we're going to go to posterior thorax. I'm turn to the side for me. First, we're gonna look for any sign of scoliosis or any abnormalities. Next, we're gonna test for respiratory excursion, so I'm gonna have you breathe in and breathe out. Respiratory excursion was symmetric. Now I'm gonna auscultate the lung fields posteriorly and laterally. Lungs sound free and clear of wheezing or bronchi. Now we're going to go to the upper extremities. We're going to test for temperature, any fever or cooling, any excess moisture, and we're going to check your turgor for any tinting. Okay, perfect. Now we're going to go down to your capillary refill within 3 seconds. Okay, make sure there's no clubbing. We're going to test for radial pulses, symmetric and radial pulses, symmetric. Now we're going to test your range of motion. So if you'll do abduction, flexion, extension, and adduction. We're going to put our hands like this. And we're going to go flexion, extension, radial, and ulnar. Perfect. Now we're going to test your neurological sensation. So have you close your eyes for me. This is sharp and this is dull. Tell me when you feel, okay?
Sharp. Dull. Dull. Sharp.
Perfect. Now we're going to test your reflexes. This is brachioradialis. And this is biceps. And behind is triceps. And you do that to both arms. Next, I'm going to have you lay flat and we're going to do your abdomen, okay? Okay. So I'm going to have you take a deep breath. Okay. Now you can let out. Your content was smooth and symmetric. You have 4 types of vowel sounds. There's hypoactive, absent, and audible. So we're going to go ahead and osculate for vowel sounds. Vowel sounds are present and audible. We can osculate for up to 10 minutes in each quadrant if we needed to. Now I'm just going to palpate for any pain or tenderness. Pain or tenderness? Perfect. Now I'm going to move down to the lower extremities. Now again, we want to assess for temperature, see if they're hot, cool, any sweating or anything like that. So now we're going to do range of motion. I'm going to do flexion and also check for the popliteal pulse behind the knee at the same time. Extension, abduction, and adduction. And I'm going to check the pulses. We have the femoral pulses, the popliteal behind the knee, the dorsal medialis, and the posterior tibialis. Now we're going to remove the toenail polish to check for cap refill, make sure there's no clubbing. Then we're going to check the reflexes, the condys. I'm going to relax your foot, and I'm just going to kind of fall here. Now we'll do the plantar reflex. Okay. And then I'm going to have you come up to the side here. And we are going to check your patellar, set your knee, and then your Achilles, which is behind your ankle, and we do that with both sides. And then any abnormal findings, we present that to the physician and see where we should go from there, okay?
Okay.
Thank you.
Thank you.